Hi, I'm Erin Walker, owner of Body Love Wellness, a holistic wellness community for women. And today we're going to continue our common hormone imbalances series by talking about low thyroid hormone. Now, this is something that is near and dear to my heart for a few reasons. One, low thyroid hormone is the most common hormone imbalance that I see in women in my practice. Secondly, it is the most missed and underdiagnosed hormone imbalance. It is sneaky and can look like a lot of other things. In my experience, it looks like early perimenopause when it actually was Hashimoto's. And thirdly, as I just mentioned, this is something that I navigate in my own life and manage naturally as a Hashimoto's patient, which is an autoimmune disorder of the thyroid, and low hypothyroidism is one of the aspects of that. So I'm going to talk a little bit today about some of the things you might feel if you have low thyroid hormone, and stick with me this week and I'll share some tips on ways that you can support yourself naturally. So if you have low thyroid hormone, you're going to feel it all over your body because every cell in your body needs thyroid hormone. That is why the thyroid is often considered to be the master endocrine system or hormone system gland. And what's interesting about this is that the body doesn't just make it and it's one and done. Your thyroid hormones have to go through different conversions and forms of that hormone before it gets to the usable form for your body to use. If it never gets to that usable form, then your body is not going to be able to benefit from the prior versions. In a nutshell, what happens is that your pituitary gland releases a hormone called thyroid stimulating hormone. And it does just that. It stimulates your thyroid to make a hormone called T4. Your thyroid then makes that hormone, T4, and then that hormone has to be converted to another hormone called T3. And that conversion happens in different places in the body. Some of that is in the thyroid, some is in your gut, some is in your liver. And so this is the connection between thyroid health and getting the most from your thyroid hormones and other parts of your body. If your gut health is compromised, you're not going to get the whole benefit from that conversion to the usable form of T3. If your liver is bogged down, you're not going to get the benefit from all the thyroid hormone that's usable in your body. That is a very simplified view of the cascade of the conversion of thyroid hormones from unusable to usable formats. But this is why thyroid health is so important, because you need that conversion process to complete itself and its optimal levels to make sure that every cell in your body has the ideal amount of thyroid hormones in order for you to thrive. Your thyroid controls everything about your endocrine system in many ways: periods, fertility, energy, brain fog, headaches, feeling like your memory just doesn't quite work the way that it used to, feeling cold, having cold hands and cold feet, joint and muscle pain, dry, brittle hair, losing hair on your scalp, other parts of the body, the outer third of your eyebrows, feeling tired and fatigued no matter how much you sleep. Sometimes even if you work out and have a hard time sweating, that can be a sign that your thyroid is off. High cholesterol, or even having a hoarse voice. You'll notice that many of these symptoms are things that you would never think would have anything to do with your thyroid. And that is why taking a functional approach to your wellness is so critical, because we look at the whole body as a system and not as separate, disparate parts. So what is the first thing that you should do if you have any of these symptoms and suspect that you may have low thyroid hormone? Well, one, get lab work done. You need a full thyroid panel. TSH is not enough. As I just explained, if you only look at TSH, it's only going to give you one piece of a bigger picture. Many times people's TSH levels are normal, but what is off is the conversion from TSH to T4 and then T3. So you're still going to feel like crap even if that TSH can be in normal range. Get a full thyroid panel, which includes total and free T3, T4, and TSH, and your thyroid antibodies. That's a great place to start to make sure you can see all aspects of what might be happening with your thyroid. So I'm going to stop there today. Again, stick with me this week and I'll share some tips on what you can do to naturally support your thyroid, to boost conversion, and to get that thyroid working for you in the right direction. Have a great week.